All right, people, so we are 7:46, and we got about 10 minutes here with Setwayul aboard, who is with us via Zoom, and it is pancreatitis, if I'm not mistaken. Did I get that correct?
Correct.
All
yes,
right,
that's
nice,
correct.
man.
That's correct.
So, morning, Set.
All right.
Your instinct
Good
and dirty?
morning to you. No, I am. I stay at home.
Me too. I didn't go. I could have got some tickets, I think, but I wasn't in that zone. So talk to us.
I went to
Pancreatitis.
Stink and Dirty during Carnival, actually. I went to one of those fests during Carnival. But when I go off fet, I do not consume any alcohol. Right? I would stick to club soda.
Oh, yeah, club soda is your thing.
Club soda and water when I go to a fet. And I will always say, if you have to drink alcohol to enjoy yourself, then you don't really know how to enjoy yourself. Right? But I'll show something, because as I'm going to speak a little bit about pancreatitis, I'm going to link that back to some recent studies that came out regarding alcohol.
Okay.
And we'll see something of the sort. So let's jump into it.
Okay.
I'm gonna share my screen here, pull up a little diagram.
Nice one.
On the pancreas. All right. So pancreas, one of probably the most important organs in the human body, especially in regards to your digestive system and maintaining homeostasis of the body. The pancreas is very important. So I think probably next week I might do a segment on the pancreas itself, because as you can see, it's a very intricate and nice. I find it, actually the area that we're looking at, for those that don't know, is this little thing here.
Okay.
There is actually pancreas. All right, so that's the pancreas there. And we see in, the ducts, pancreatic ducts, and you see it leads into the digestive system here. And we have the pancreatic islets. And these are, you have the endocrine and exocrine cells. And next week I would go in a little more into that, because I want to go into pancreatitis, because anytime you see a word ending in itis, it means it suffers from disease or inflammation.
Right.
Now, inflammation is when, it's the body's response to an irritant or an infection. So whether something is causing an irritation of the pancreas or causing an infection in the pancreas, that is what would be classed as pancreatitis. Let me pull up another diagram here, and you would see why I say I would be linking it into the fat. So we see in here a normal pancreas. Yeah. Right, everything looking good and normal. And then we have across on this side where we have acute pancreatitis. Right, so we have acute pancreatitis here. So we see, some discoloration and stuff like that taking place. But here we have possible causes. We have gallstones, and we have alcohol abuse. Right, so you see where we're going and linked to what I was mentioning earlier. Yeah. Right. Now, when these things happen, it can cause enzymes that are produced in the pancreas to end up attacking the pancreas itself. These enzymes supposed to be released into the digestive system for the breaking down of the food that you consume. Right. But when there's inflammation, these enzymes can be released into the pancreas itself, and then that could cause degradation and calcification of the pancreas. You can lose some of the cells in the pancreas, which can affect the production of hormones now, like glucagon and insulin. And that now can lead to conditions like diabetes, right, where you have insulin resistance. And then eventually some people have to take insulin injections. Right. So the pancreas have important role and function. Now, alcohol abuse is very common, especially in Trinidad and Tobago. Now, I'm going to stop sharing the screen and then reshare it, because I want to show you all a particular article of a study that was published. So this study here, which was published, as you could see here, June 18th. And this was taken from the actual study that was published, June 18th here, 2023 here. Yeah. And it has to do, I'm sure you come across with plenty of people that say, or they might tell somebody, hey, you can't hold your liquor. Yeah. You can't hold your liquor, boy. Right. So what this study did was they were comparing people that are regular drinkers to non-regular drinkers, all right? In other words, people that have alcohol use disorder, right? Which I could tell you, many Trinidadians have alcohol use disorder and don't know that they have alcohol use disorder.
Okay.
Where they drink a lot, very often, all right? And what happens is, what they did find was that light drinkers, yes, people with alcohol use disorder, when they drink to normal intoxication levels, right, in comparison with a light alcohol drinker, they could handle their alcohol better than the light alcohol drinker. But the problem with people with alcohol use disorder, so that's around 3 or 4 beers, right? The average alcohol use disorder person do not stop at 3 to 4 beers. They continue. What they notice is that when they continue, their impairment, let me close the screen here, their impairment dramatically increases. So when they are comparing themselves with the light drinker who's going to stop at about 3 to 4 drinks because they say they're feeling a little buzz, the person with the alcohol use disorder, they are going to continue because they are comparing their self with the individual that is the light drinker and saying, hey, you're a featherweight, you can't hold your liquor. And when they continue, the effects that takes place, the impairment that takes place on their body is way more, way more, right after they pass that threshold.
Okay.
Before they pass that threshold, they recover quickly. After they pass that threshold, their impairment increases by over 50%. And then it lasts longer than 3 hours.
Okay.
So when people go to the vets and they're thinking, if you notice a lot of the times when these accidents happen, you'll hear somebody say, but that person is a regular drinker, you know, right? So how they get in that, right? Them accustomed drinking and driving, you hear that a lot.
Yeah, they hear that plenty.
It's because once they cross that threshold, the effect more than doubles, the impairment more than doubles, right? And that mindset of thinking, well, I am a regular drinker, I can handle my liquor, is why it had so much accidents yesterday, right?
Yeah,
that's why it had so much accidents, because people are thinking, hey, I can handle my liquor. So when we go back to when it comes to the pancreas and pancreatitis, alcohol is one of the causes for acute and can lead to chronic pancreatitis. The other thing is, other things that we consume, other toxins in our food and so forth, other even environmental toxins, can affect the pancreas as well. Back in 1970, we had cases where people got stung from scorpions, and that actually caused acute pancreatitis.
Right.
Because things that are circulating in your blood, remember your blood travels through every part of your body.
Every part of your body.
Every part of your body. And of course, the pancreas is an organ, but it still needs blood in order to function.
Right.
And therefore, if you are consuming stuff that are harming or that are toxic and it's in your bloodstream, then your pancreas can be affected. Now, what I have observed is that many people suffer with pancreatitis and they are unaware of it.
Okay.
They are unaware of it. So when it comes to some of the symptoms of pancreatitis, here are some of the symptoms, and I'm sure a lot of people viewing would be able to relate. Pain in the abdominal area that radiates to the back.
Okay.
That's something a lot of people suffer from. They might go and even get their kidneys tested and realize, no, they don't have a kidney problem. Then it's very likely that you have a pancreatitis problem.
Yeah.
Right? Nausea and vomiting. So
yeah, that's a regular.
And then that's a regular thing as well. So this happens to a lot of people also, right? Fever and chills. Some people get these little fevers and chills just so and wonder what's going on there.
Yeah.
And then you have tenderness and swelling of the abdominal. You also have diarrhea. Some people get diarrhea a lot.
Yes.
Wondering why, right? And then you have people that have a lot of fat in their stool.
Yeah.
And they have indigestion, and then they are signs of malnutrition, right? So these are things that can show that you have a pancreatic issue. Now, when it comes to some of the solutions for pancreatitis, because I know we're running low on time, is the fact that The best thing for it is to rest it.
Just rest
But
it.
there's another problem. Yeah.
Okay.
Because to rest it, you have to fast. A lot of people, by the time they reach this stage and they realize there's a problem with the pancreas, they have lost too much muscle mass to rest it. Right? So now you're between a rock and a hard place. All right? So that's why I'll tell people, if you have to deal with it, come and check me. Because we have to go on a balancing act. We have to go on a balancing act as to what you can eat
and what you can.
In order for you to get some rest, to build back up some mass, so that you can truly rest it.
All right.
All right? So it have a little balancing act to do, kind of like a dance.
All right, nice man. So for more information on that, all you need to do is call Seth Viola Board 7611952. That is 7611952. The Holistic Health Clinic is going on. Don't manage it, reverse it. Seth, thanks a lot, man.
Thanks for having me.
All right, man. Next week. So that's Seth Viola Board.